Expertgruppen för biståndsanalys, EBA, är en statlig kommitté som oberoende analyserar och utvärderar svenskt internationellt bistånd för att det ska kunna förbättras och utvecklas. EBA har 10 ledamöter med kompetenser från olika biståndsområden och ett kansli som verkställer besluten. Förutom våra rapporter så ordnar vi seminarier, workshops och möten mellan olika parter. Varje år sammanfattar EBA sin verksamhet i årsberättelsen Biståndsanalys. Den kan beställas från kansliet eller laddas ner på eba.se. EBA har ett oberoende i relation till uppdragsgivaren regeringen, liksom i relation till vad som utvärderas, samt till de rapportförfattare som anlitas. Rapportförfattarna ansvarar själva för slutsatser och rekommendationer i sina studier. Allt vi producerar som rapporter, seminarier och vår podcast EBA-podden finns tillgängligt på vår hemsida.
Good morning and welcome to this EBA seminar carrying the title Payment by Results in Aid, Does it Work in Practice? My name is Petterson. I'm the Managing Director of EBA, and I'll be guiding you through these 75 minutes or so. Before we start, I would like those of you following us on Zoom to pose your questions using the Q&A function. The discussion today will be about the set of contractual relations referred collectively to as payment by results. Every relation in development cooperation includes some type of contract where someone, a donor or a principal, provides funding to someone that we might call a recipient or an agent in order to do something. Now this something could be the production of a collective good, advocating for human rights, reducing greenhouse emissions, improving domestic institutions, or delivering services or goods to some end user beneficiary. For example, through the provision of health services or education. However, the funding party does not really know the amount of effort that the recipient or the implementer of the contract puts into the accomplishment of the contract. This information asymmetry is really at the heart of the problem that is thought to be solved by payment by results. Essentially by agreeing on a set of results to be obtained, paying for them once they are so observed, objectives of both contracting parties become aligned. The focus of the relationship will be on results and performance, and it will really focus on the what to achieve, leaving the how to do it to the implementer. Now, given the attractiveness of this argument, it seems like a no-brainer not to use it widely. Why would we not expect all aid to be in some kind of payment by results solution? With us today to provide some nuance to this, we have Professor Geske Dijkstra. You are warmly welcome. You have a long and broad CV, but in attempt to summarize it, you are Emeritus Professor at Erasmus University at the Institution for Governance and Global Development. Your academic work comprises several books and numerous peer-reviewed journal articles. But next to this, you have also done a lot of evaluations for various development aid agencies, including Sida, on topics like social development, poverty reduction, debt relief, gender, good governance, And you also wrote an EBA report on budget support to us a few years back. Now you have authored an EBA working paper titled Payment by Results in Aid, a review of the evidence. This report is available at our homepage, eba.se. And without further ado, I leave the screen to you, Geske.
Well, thank you very much, Jan. I'm going to present this report in about 15 minutes. I will try. So let's start with what is payment by results. I think Jan referred to it already. I hope it works. Yes. So at least part of aid funds is transferred after results are achieved. So we can indeed look at it as a principal-agent relationship where the principal is the donor who wants to achieve certain results, but the donor cannot be sure that the implementing agent will have exactly the same objectives and also cannot observe the efforts of the agent. So this looked like a brilliant solution to it. Donors need to show results, especially nowadays that some publics are more skeptical about aid. And it's expected to lead to greater accountability, both to the taxpayers, but also to the ultimate recipients. It can also be seen as a form of ex post conditionality. We know that ex ante conditionality, buying reforms, does not work. And this way of paying for the ultimate outcomes could foster ownership so that the recipient can choose their own ways to carry out the activities and also innovation. It also comes a little bit out of the dissolutions with budget support, because budget support can also, of course, foster ownership and innovation, but it has been used also for promoting good governance, and that didn't work. So then donors become disillusioned with this modality, and budget support became less popular after about 2010. So what I will do in this overview of this report, the introduction, that's where we are now. I will say something about the theory of payment by results, because it's not only expected advantages, there are also risks involved. The methodology for this report, the results, and some conclusions. So about theory, there are two types of payments by results covered in this report. And this is a distinction that is made by most authors of this modality. You have results-based aid, RBA, where there is the donor and the national recipient government. And there is results-based finance, RBF, that can take many other forms. The principal can be a donor, the government, a subnational government even, or an NGO. And the agent can be any type of service provider. So it can be subnational governments, it can be private agents, it can be NGOs. And of course, there are also hybrid forms, because there are forms that there is a donor that may contract a private agency, but also a national government. And this is, for example, OBA, output-based aid, promoted by the World Bank, but also implemented and financed by other donors. Output-based aid can be in any sector, and it is really kind of often a subsidy is given to cover the cost the difference between the costs for the provider and what a poor customer can pay. Well, theory, this is kind of complicated scheme, but let me guide you through it perhaps. Let's start with the first column. So the expected advantages are that there will be more results, more efforts of the agent, more alignment of objectives of principal and agents, improved transparency and accountability, have better data on what aid achieves, innovation, equity, that's the expectation is that it may be negatively affected, because if results have to be achieved, it's of course easier to target the not poorest clients or the faraway regions. It's easier to look close by and to do to achieve the results there. But on the other hand, targeting is possible. So poor clients, customers can be targeted with this type of aid. Now let's look at the second column now on the top, the mechanisms and the conditions. Yeah, of course, the incentives must work. And the risk is that there is too much control and that implementing agents lose their intrinsic motivation. That's in the risks column in the third column. Another condition, the agent must be able to influence the indicator. If you choose an indicator, like if a school is incentivized and the indicator is improved literacy, well, that may depend on many other factors. So then there is the risk in the risk column of non-payment, despite great efforts of the implementing agency. The indicator must also be in line with the objective. And this can be a problem as well. If, again, in the education sector, the example can be if completion rates are rewarded by the donor, this can be achieved, higher completion rates, by improving the quality of education, but also by lowering the standards. So then the results will not be according to what the donor wants. And another risk is that there will be distortion, that all the efforts will be directed to achieving the indicator, but that other important areas will not be given attention. And gaming is also possible, and that is that the numbers are simply made up. In governance, for example, if meetings have to be held, you can just report some minutes and you can just write the minutes without having any meeting. Condition for alignment is that all stakeholders must be involved. For improved transparency, there should be good data available, or independent verification is needed. For innovation, the results should really be defined at outcome or impact level, so not on process level or output level, which is closer by, more the agent will be able to influence it more, but there will be no stimulus for innovation, for inventing new things. I think I explained more or less the other things. And there are also costs involved of this in this aid modality. There has to be paid a risk premium. There are preparation costs, but they are, of course, they hold for all types of modalities, aid modalities, and verification costs and the cost of targeting. Well, what I did was search in academic databases together with a research assistant, Web of Science and Scopus, in Google Scholar websites, with a large number of search terms. You can imagine it can be called outcome-based aid or performance-based aid, or no, there were many search terms. So there were then also many sources that came out of that. So we had to remove duplicates, project documents, master thesis, and also sources that were not on these two types of modalities, the RBF or the IBA. We also excluded sources on RED Plus or on payment for environmental services. 170 sources remained, but then we had to apply inclusion criteria. The sources should really say something on how payment by results works and what the effects are. And there should be some indication of methodology in it. So 48 sources remained, and we included reviews of payment by research. And this is the overview of the 48 sources. You can see in the first line here that 60% of these 48 sources were on health. And I think this is in line with also the sector where it has been applied most. There were 5 sources on education and also 8 sources on multiple sources and a few sources on the other sectors. Well, the results. On effectiveness, you can see that the positive effects and the negative effects, and of also neutral mixed effects, they balance each other out. So there is not a straightforward positive effect. It is really balanced, it's really mixed. And it seems that studies on health appear to show higher numbers. But if you look at the 7 reviews in health, they all conclude that the evidence base is very weak. And unintended effects, like distortion or gaming, are seldom reported. So this is part of the table in the report. With the 7 reviews in health, 4 of them are systematic, these last 4. Here we have some higher numbers, but the red numbers mean that the evidence is very weak, according to the authors, and the purple, the evidence is weak. Yeah, so if you take that into account, these numbers are a bit lower. And unintended effects are seldom reported here in only 12 cases out of 117 studies that have been reviewed. The reviews also conclude that data are not always independently verified. So we just take the numbers as that have been presented to the donors, but they have not been independently verified. And cost effectiveness is often not examined. There were 22 case studies on health, and 14 of them are on 2 relatively successful programs. And I think it's interesting to tell you a bit about one of them. That was the Salud Mesoamerica initiative, a health program in all Central American countries and the region Chiapas in Mexico. And it really focused on the poorest sectors of the population to improve mother and child care there. And the governments had to contribute 50% of the cost of improving this healthcare, and the donors gave the other 50%. And if the results were met, the governments received 25% extra money, and they could spend it in health anywhere. And this seemed to be a really good incentive, and the targets were really met, so that mother and the healthcare for mothers and newborns really improved in the poorest areas in these countries. But there were many studies on that, so that also distorts the overall results. And another conclusion, another result is that there was very limited information on other aspects of payment by results. So to the extent there was some information on alignment, sometimes indeed the priorities were changed. So that was the Salud Mesoamerica initiative. It worked well because the governments really changed their priorities. They really made sure that more resources went to these poorest areas to improve healthcare there. On transparency, accountability, improved data system, the results were really mixed. In some cases, data systems improved. In other cases, they even deteriorated due to the introduction of payment by results, because the implementing agents really started to manipulate the numbers. On innovation, sometimes positive effects, but in many cases, the indicators were chosen at a too low level, on process or output level, and that hampers innovation. If targeting was applied, the effects were usually positive. But without targeting, if just results were asked, it often had a negative effect on equity, to the extent that this was investigated. And as I said, there's not so much evidence on it. On cost effectiveness, there's also very little evidence. So payment by results usually involves some extra cost, so you can compare it with other interventions, but seldom it has been looked at whether whether the benefits of payment by results really outweigh the cost of it. But to the extent it has been done, there are positive and negative effects. So it seems that there are mixed effects on all these areas, and it really depends on the design of the system and, very importantly, on the context. But what I found is that it also depends on type and sector. But let me start with design and context. Positive design features, according to other reviews as well, the involvement of all stakeholders in the design of the payment by results contract, some flexibility in setting and changing indicators. This was also the case for this Salud Mesoamerica initiative. Indicators changed all the time in collaboration with the implementing agents, but that also helped to reduce the chances of manipulation of the numbers. There should be a perception of fairness of the indicators, and independent verification is also important. In terms of context, there should be sufficient staff, resources, and infrastructure available, but of course this holds for all aid. That's always a problem. For payment by results, the agent should have sufficient autonomy, and the principal should be willing to withhold the money. If that doesn't happen, of course, there is no incentive, and there are many cases of this where the principal was not willing to withhold the money. And a context feature that's also helpful, if there is lower alignment at the outset, for example, if the private sector is involved, is not inherently interested in serving poor regions, because that costs more effort, more costs. So in that case, payment by results can help to align the objectives of the donor with the implementing agent. Now about why it may differ also by type and sector. There are three, as I see it, important trade-offs in how to make the contract and payment by results. The indicator, of course, must be able to be influenced by the agent, but if that's the case, the indicators tend to be very close, but tend to be process indicators. So in the education sector, again, just school enrollment, children should be in school. But if you choose that as an indicator, you are not sure whether that also leads to the ultimate objective, and it doesn't stimulate innovation. Another difficult trade-off is, and I hinted at it already, donors always prefer to have predictable disbursement, and of course recipients as well. But that clashes with incentivizing performance. Yes, you can choose easy indicators, but they don't stimulate performance very much. But it does guarantee predictable disbursement. And then third, an indicator should provide sufficient material incentive, but if large incentives are involved, there is also an incentive for gaming or for distortion. So for focusing the efforts only on what is measured and what is rewarded, and not on other important activities, or on quality. If quality is not in the results that are awarded, the quality may deteriorate. However, these trade-offs seem to vary by sector and by type of agent and circumstances. The first and the second trade-off, they will be more serious if there is a longer results chain. So a chain between the activities or the inputs and the ultimate impact. If there are many steps in between, these first and second trade-off are more severe. And perhaps the first trade-off is more serious in education than in health. In health, if you provide care, if there are, for example, institutional deliveries, chances are that maternal mortality will decrease. Perhaps these chances are bigger than if the relationship between, for example, child enrollment in schools and literacy. The second trade-off is more serious if there's greater mutual dependency between the donor and the implementing agent. And in a bilateral aid, the relationship, this mutual dependency is higher than between, say, a donor and a private agent. And the third trade-off is more serious if agents have multiple and complex tasks. Like in healthcare, they have to do multiple things, not only mother and newborn care, which is often incentivized with this type of aid. But there are multiple and complex tasks, and if quality is not easily measurable. And this also holds for example, in governance, in stimulating the capacity in local government, that can also be more difficult here. So there's more chances of gaming and distortion if you try to do payment by results in those areas. So what to make up from this, of this very mixed results? It seems that payment by results is most appropriate in sectors with shorter results chain, energy and water, for example. unfortunately, there's not so much hard evidence in these sectors, but it seems that it's more appropriate to use it there. And also, if there is less alignment between principal and agent at the outset, we can imagine that in health and education, the workers there are intrinsically motivated to improve the health of the populations that are served by them, while maybe a private sector agent is not that intrinsically motivated to bring energy to poor regions. So the third appropriate criterion could be if private resources can be mobilized by this type of aid. In other cases, I would say that perhaps direct budget support or core funding to implementing agents could be a better solution, instead of setting up these complicated and risky payment by results. Thank you for your attention.
Thank you very much, Geske. I will soon let our discussant in, but first we do have some questions for clarification from the audience. So there's one question on the table you showed, saying that the evidence was weak, and what is actually meant with weak evidence. Would it be in size of results, in statistical significance, or that results varies? Please, Geske.
Yeah, well, that could be many different things. So in some cases, there was not a rigorous counterfactual. So it was only looked at whether the targets were achieved, the target set in the contract, but it was not compared with other modes of financing or another aid modality. In other cases, there was no independent verification. The quality of data was low, so it was only given by the implementing agent. So these kind of things. That is the reason for the weak evidence. And for example, the Dijkstra, who has the highest percentage here, she said there was no information on cost effectiveness. So, and also not all the studies were rigorous. There were better results at process or output level than at outcome or impact level. Then the percentages of positive outcomes went down. So there are many different reasons, but these assessments were made by the authors themselves. So very weak evidence in this first two and also in Dijkstra. So the evidence base is really still small. You can conclude, yeah.
Thanks. There's a few other questions. Now I'll take some of them now. So there's two questions relating to terms used. They ask you to please explain first what gaming is and how it works, and also the term innovation. Is it more or less doing an intervention differently? Would that be the understanding of innovation in this case?
Yeah. Okay. Yeah. Gaming is that the numbers are really manipulated. Of course, if your reward, your income depends on the numbers, you can just make up numbers. And the example, I can give an example that was in Ghana, where they set up, in the context of decentralization, they wanted to improve governance of local governments, and they had to hold meetings with the population to discuss the quality of services. And in one district, they held the meetings, but nothing was discussed. And in another, they even just wrote minutes without having any meetings at all. But they qualified, of course, for this indicator. So that's gaming, just making up numbers. Innovation, yeah, the idea is that if agents are responsible for results, if you define the results, say literacy of children, then they are free to choose the methods for how to do it. Yeah, so you really have to define an indicator at outcome level, governments for results-based aid, it could be reduce child mortality. And how you do it doesn't matter, but as long as child mortality is reduced, you can choose your own ways of doing so. So that's the idea with stimulating innovation. But of course, if you set then an indicator very close by, so children have to go to the health center twice a year, small children, then you don't stimulate innovation that much.
Okay. I'll just take one more because it's been actually a few questions on the same topic, and that is, why did you not include RED Plus interventions in the review? Okay. So RED Plus, just the one very maybe not correct, but quick explanation for those who don't know what RED Plus is that it's initiatives to reduce human pressure on forests, focusing mainly on conservation. Yeah,
reduce the emissions from deforestation and this is a UN program that tries to improve policies in the area, and then the idea is that donors can also jump on it and provide results-based finance. But it's a rather complicated area because to measure deforestation, you have to include a kind of baseline. So the policy should already be there before this results-based finance can come in. It has happened, but there are some evaluation. But since it's such a complicated area, and well, to keep this report a bit manageable, I decided to leave it out. But of course, it is results-based finance, but the complications are: what is the baseline? What do you take as less deforestation or more? More protection of the forest or less protection of the forest? How do you measure this? It gives a lot more complications. But maybe it's worthwhile to do another study about results-based finance in this area. So would a correct understanding of your answer be that your kind of conjecture of results within RED Plus is that the evidence would be mixed there as well, or? That would be my conjecture, but I didn't test that. Yeah, the things that I read are indeed a little bit mixed. Yeah. Yeah.
Thank you. So now, in order to discuss this report, we have with us Ulf Källstig. Ulf, you're development professional with decades of experience from different African countries. You've worked in civil society, the UN, and for the Swedish government. You've held also several senior positions at Sida headquarters, and you are currently Assistant Director General and heading the Africa Department. Very welcome, Ulf. I would like to ask you if you could present how Sida works with this method. What's the agencies and your professional experience from it, and also, of course, what are your comments, reactions, and questions to Geske's presentation? Please, the screen is yours.
Thank you very much, Jan. And first of all, thanks to EBA and to Geske, especially for this review of all these different initiatives, programs, and projects. That really gives an overview, and for me, reading it was like a travel in time. Over the last 10 years, where have we been? What have we been doing? What are the experiences, etc. So that in itself was really, really interesting at this overview level. When I look at it, I also can see that. The structure you built it in and how you've looked at it. It also, when you come to the conclusions you presented, the three, it really sort of resonates with my experience from a practitioner's point of view. In many ways, we started off in social sectors. We started off with the assumption we were working a lot with government. And if you look at over the last 10, 15 years, Sida's mission has been, in Africa especially, to move from more developed countries to less developed and more fragile countries. Also a move from working more directly with government, as in the budget support paradigm that you referred to in your presentation, to working through proxies, be it civil society, other agents, private sector, UN, World Bank, etc., rather than looking straight at government. For example, in last year, I think Sida's overall portfolio, 6% had a direct government-to-government agreement. In Africa, it was a bit larger, it was 13%. That was completely different 15 years ago. So from that perspective, I was also interested from the social sectors, and where we see it being used more these days is in incentivizing private sector coming in and contributing to financing, to risk-taking, etc. So I would say from education, other social sectors, over to mostly energy in relation to private sector. That's sort of the move we've made, which is so interesting because it's very much of when you tell the story, Geske, and you come to that conclusion, probably here it would be, but we don't have solid evidence. And I think it's because of part of the trend is that we're moving in that direction, and it takes time before independent evaluations can build up some learning on that. And my guess it will still be mixed. The other thing that's really interesting in your report is that you talk about the importance of the context. And I think this also resonates well with us. At Sida, we've been for over 20 years now commissioned to work with strategies rather than programs and projects. So the government gives us to work with strategies, for example, bilateral, Tanzania, Rwanda, South Sudan, etc. And then we are to work in a number of sectors or areas, thematic areas more. And then it's up to us to define what is in that chain, the how. How do we do this? How do we achieve results? And the fundamental thing in our instruction is to work with local ownership. So that's where we are in the how. And then, of course, what we do these days is we do a multidimensional poverty analysis. We look at who are the actors, where's the poverty? Who are the actors, private sector, NGOs, universities, government, etc., that can play a role? Who would be close enough to drive the same agenda as us? And which can we work with that we can nudge a bit maybe? So with that sort of overall frame, that is the context that our mission is given in. And then, of course, when you look at specifically at RBA or RBF or OBA, that can be one tool in the box. But the advantage we're having, and I'm realizing it more and more in the last few years, that Sida is quite unique here. We have different tools. We can work with the results-based. We can work with core support. We can work with project and program support. We can work with guarantees. So we have different tools in the box. And I think that is what is guiding us in analyzing this context. Which tool should be used where? And there I can see that the results-based has been more tilted into energy private sector. And here comes also the guarantees in as one part of it. But the question I would like to ask to Geske in this case is, when you look at the tables and the analysis and everything, you mentioned the context. You don't talk much about ownership, because to me, for development to actually be more sustainable, I would say. I mean, the dream of sustainable is something else, but less short-sighted, slightly more long-term and sustainable. The local ownership and the drive in the agent, in the society, in the community is really key. Did you see anything on this? Because there is a risk, I see, by setting indicators, it could also be based on the presumptions of the donor rather than the drive for development in the local society.
Thank you, Ulf. Geske, you got some questions there, so I'll turn to you directly and ask if you would like to answer them, and maybe also you have some questions back to Ulf, please.
Yeah, thank you. Yes, thanks for your comments, Ulf. Yeah, you said you're moving into energy, and that's interesting because that's what I also recommend. And you say it's recent, but this output-based aid already started around 2000 or maybe even earlier. And there have been projects in energy already for a long time. Unfortunately, they have not been evaluated in a rigorous way. While this would have been possible, but really comparing output-based aid with other types of aid modalities and setting up a good research design, that hasn't happened yet. So I think it's high time to do that. On ownership, yeah, I think in general that could be a problem. And well, sustainability is always a problem, of course. You want it to be owned and you want it to become sustainable because the implementing agent wants to continue the activities. And with results-based aid, there is the risk that as soon as you stop rewarding certain results, that maybe it stops. But of course, that's a problem with all aid. So I found a few studies that looked at this sustainability, and some of them positive, others negative. And this example of the Salud Mesoamerica initiative was one of the, there was a study that really said this is a sustainable activity because the governments now had a lot more knowledge. They learned from the experience. They also set up their own data system. So there was independent verification organized by the donors, but they also set up their own systems because they really wanted to know what was happening in these poor areas. So there also here it depends on the context, and it can work well. It can become sustainable programs. So this priority for this poorest region in healthcare in Central America, I think this was longer lasting according to these studies.
So Sida's move towards the energy sector, then it would be into a sector where kind of this result chain is narrower and focused on outputs to a large extent. That would be RBF to get the acronyms right? Okay. So that relates to a question posed by the audience. Why do you use payment by results at all if a private sector can be just directly commissioned to deliver a result?
Yeah, that's a very good question. Please, Geske.
Yeah, I would say that you can then measure whether results has been achieved. You can. Why would you trust the private sector doing something which is not in their interest because it will perhaps be costly? So if you use payment by results in that case, you can really establish whether the energy, the connection to the grid has been made in a poor area.
Another example I could bring up is that in Eastern Africa, we had a small initiative, I think it was in Rwanda, a private sector that was established, or Kenya, doing home solar panels. And we realized in a market survey that there should be a market for this, also in Tanzania and bigger markets in Kenya as well. But lack of capital and lack of risk or ambition, risk aversion, I would say, limited the private sector to really move in. So then we did a bit of an RBA or RBF approach here, where we would then, okay, if you invest here, we will do this and that. And that led to like 80,000 solar home sets in a couple of years. So then you can nudge the market to take a bit more risk by risk sharing. And that's where you also move into our other instrument, paper guarantee, when we can lend Swedish security on the financial markets to a farmer or an entrepreneur to take to the bank to get the commercial loan. So that sort of nudging, I think that's where it can play a hybrid role, because ultimately, if you look at financing situation and development financing in Africa, the only thing development cooperation can be is small portion that could be catalytical. That's what we can do. But we need to release the real capital, the private investments, the flow of tax and tax financed social security, etc. So in that sort of intersection, it's important. Also, the negotiations by itself, I think, is really, really important. Because then you get to discuss what is it that we really want to achieve and how different or aligned are our objectives and what's the risk in between.
So that would point at the importance of the process in order to align objectives between. Okay, thanks. Geske, you mentioned the Mesoamerica Salud in Health Initiative, and that seems to be really kind of one of the good examples of a large regional program. So would you like to say a bit more on why this initiative worked, and how does it differ from programs that didn't work, and well, why isn't the setup copied and used elsewhere?
Yeah, there are studies about how it worked, and I think there were a couple of factors mentioned. The first one was that there was really a flexible design, so that all the governments of the area and also of the region Chiapas in Mexico, they came together and they discussed possible indicators, but these indicators could change from year to year depending on what had already achieved or the circumstances that had changed. Another was the regional approach, because this led to kind of competition between the states, the governments. They all wanted to show that they did well, and they all wanted to gain the money, this extra 25% of the investment, and that they could spend at their own discretion. So, and they all, and there was also a culture of learning was stimulated by this program. So they, as I said, there was independent verification, but they wanted to improve their own monitoring system. This program was coordinated by the Inter-American Development Bank, and this IDB also provided technical assistance to improve the data systems of the countries themselves. And this also stimulated learning, because they also decided what kind of data do we need and for our own data, for our own making our own improvements in healthcare. So, and there were external evaluations also, so this also helped. So from the start, it was decided to have some rigorous evaluation of the program. So I think these were the four factors that were mentioned in the studies about this program, why it was so positive. And of course, it was not across the board everywhere positive, but on the whole, on average, there were achievements of this program. Yeah, and why? I think it could be a good example, but yeah, maybe it's easier in countries where you already have a certain level of development. I can imagine in fragile states, this is perhaps not so easy to accomplish. So it really still depends on the context.
I could build on that a bit, if okay, and that is because when I read, especially the part on education, and brought back memories from Tanzania and the education program, the World Bank and ours program there for results. What was really, I would say, a positive side effect was that when having discussions and negotiations with the ministry, the World Bank, and the British colleagues on the indicators and targets, of course also with civil society in the room, there was it led to that we could pursue, together with the ministry, more local ownership. Because in that room, civil society would ask for how do we reach out to the districts? Where do we go? The government would be very interested in reaching out to the hard to reach areas, because that's more expensive for them. And how do we have indicators in relation to that? And on the other hand, if I may be a bit blunt, the World Bank would like to see lots of results, which is more easily achieved in an urban setting, right? Yeah. So there, with our Swedish approach on local ownership and prioritizing the poor, in that these biannual discussions every 6 months, we could bit by bit make sure that the power play in the room tilted towards the hard to reach areas and the local ownership. That's how I would describe it in a very subjective way from the Swedish side. And I'm sure the World Bank would have a slightly different, but that discussion also led to that we had to harmonize together as donors, and that gave government and the NGOs, locals, more power in the room. And this is, when you talk about the context, these are the things that comes back to me. And of course, if you look at the Latin American program, I guess these things happened at district and local levels and at the central level. And these discussions and negotiations that are not well documented in many cases and very hard to evaluate and review afterwards are very, very important to the success or failure of such a program and to wanted or not wanted side effects.
Yeah, that's a good point. I think we need these rigorous evaluations with the counterfactual, but we also need qualitative research into these kind of things. What was the policy dialogue exactly, and how were people involved, and what were the different arguments? Yeah.
And who called who before the meeting and after?
Yeah.
May I return? You mentioned side effects, and reading the working paper, Geske, you do mention in a couple of places something that kind of points at the risk of results-based finance solution to actually kind of break the do no harm principle. You write that RBF in health in fragile states have had negative effects, and you refer to a study pointing to an ethical conflict among health workers when having to choose between what you write, necessary care and rewarded care. Do we know that these examples are due to the method? Would this actually mean that the method in some instances have caused harm?
Yeah, I think this is long study indeed on Rwanda, but a qualitative study. You don't get this with the quantitative rigorous study. Indeed, then it seemed to do harm, and that's really due to the payment by result, by applying it in a context where the staff does not have enough resources for this. They are already, they have to choose then really between doing what satisfying the indicators, meeting the indicators that will be rewarded, and then they cannot do everything, so then they have to leave other types of care, other people unattended. Yeah, I think then payment by results does more harm than good. It would be much better to first increase the core funding for those health institutions, to increase the staff, and then you can do payment by results. But if you want to focus on certain areas, because in healthcare, of course, how to decide what you want to incentivize. I guess that the people involved know better what is the most serious health problem to be cured.
If I may build on that, because this is really also telling a wider story about development cooperation. On the one hand, you can talk about a project approach, where somebody decides what should be the outcomes in the coming 3 or 4 years. Then this risk is also great, even if it's not a results-based. It's a presumption of what's needed somewhere else over time. Then you have a program approach which is more wider and gives a better flexibility for the agent. And then you could have core support, as you say, Geske, where you have maximum flexibility towards a goal or an intended effect, where the local agent can then invest. In the best of worlds, the local agent can then be flexible in relation to that. And that it really doesn't matter if it's results-based or just designed at headquarters somewhere else to specific targets. and pre-financed, you still have that problem. So also your conclusion in the report very much that core support is really the most innovative and flexible you can do, because that gives the power to the one closest to the problem. So in here, I think also you can look at how development agencies work over time, and that could be another interesting review. And that is the level of delegation of authority. Because if you have centralized decision-making over, say, $4 million or something like that, or $3 million or $2 million, you will make the decision at the headquarters, which is normally in the Western Hemisphere, far away from the development situation. If you have delegated authority to the local team at the embassy, they can be more aware of what's happening and choose the set of tools they want and adjust more over time. So this is also parameters that are greater and wider than the actual instrument of RBA or RBF, but built in trade-offs in development cooperation, depending on where the decision-making is delegated.
So delegation then would leave to embassies and Sida to decide when and when not payment by results solutions are suitable. That would also demand that there's sufficient competence at locally at embassies as well. What would your take on that be, Ulf? Is Sida embassies in Africa well equipped to decide whether or not to? Because it also relates to what you said, that kind of the choice of channels has changed. So the limited amount of state-to-state cooperation now, and the increase of multi-B and the use of NGOs, and so doesn't that, I mean, take away the possibility for Sida to actually determine whether or not to use PBR, because that would then be the channel that will determine what methods to use?
Of course, you're right in many ways. If you ask a civil servant if they have enough resources, the answer will be only one. It would be better with more, right? But if you're more sophisticated, you will say, okay, what we try to do, and we try to delegate authority up to $8 million, all decisions are made at the embassy. And we try to have specialists, a local and a Swedish specialist in each area we work at the embassy. And then, of course, we work closely with support from head office, but they are in the driving seat. That's what we try to do. I would say that, and I think that it showed quite a lot, if I may put it into a context. It showed quite good evidence in evaluations done of how we responded to COVID. When you could change an agreement just by having an email conversation locally and a telephone and a meeting and a discussion, or if you had to go back to a headquarters somewhere. There was an evaluation of 3 donors on COVID where that effect really showed that the closer you were with the decision-making to the actual situation, the more flexible and effective you became in adapting. Then, of course, the long-term results, you will have to wait to see.
This also relates to, there's a question of, and given the decentralized nature that you mentioned, I don't know if it's possible to ask, but it is a question of what would be your guess maybe then on how much of Swedish aid is actually in any of the types of RBA or RBF?
Very little. Because I don't have statistics. It's not in our statistical system. We have a lot of different statistical figures reporting to DAC, but it's not the RBA as a method. I cannot find it easily, especially not hybrid. But what I can see is we did it in social sectors. An education program in Tanzania was probably the largest we did. Actually. And then the energy, of course, as you say, Geske, energy has been there, and RBA in RBF or RBA in energy has been there for years. But for us, it came a lot after 2012, when we joined the initiative on Power Africa and decided to try to to increase a lot on both guarantee and support, grant support to energy in Africa. And that's when it was explored and developed more and more, and went hand in hand with us being able to use more and more of the guarantee instrument. So that's where it built up. And then, of course, that relation to private sector, and that was a trend also 12 to 16, 17, how to stimulate more investments from private sector. We started measuring that, and of course that led into this. So I would say it's a limited use. I would say today mostly in relation to private sector entrepreneurship and specifically energy. Of course there are other cases somewhere. I'm not fully conversant with all 2,700 agreements we have right now.
You're not, okay.
No, I have to admit.
So, but mainly then RBF in the energy sector more than RBA.
Yes, definitely, and hybrids. Geske has to answer.
It's very difficult to say exactly these numbers, because there is, Ulf, I think you're referring to the bilateral programs, but many donors also support the World Bank Trust Funds in these areas. So you have the HRITF, the Health Results Innovation Trust Fund, and there's something similar now for education called REACH, and many bilateral donors support these trust funds at the World Bank, and that also stimulates output-based or results-based finance or payment by results. So to really get numbers, it's difficult.
Yeah, you're really right, Geske. I'm referring mostly to the bilateral, and of course our global support through these trust funds are, of course, in that case, we are in many places together with World Bank and others.
Yeah,
absolutely. And we need to continue to explore this, because it's also always a question of finding alignment with agents, but also nudging agents into taking risks and opportunities they haven't taken before.
Yeah.
So can we return a bit to we talked a bit about the external validity of your results, Geske. Your conjecture was that in RED Plus results would be expected to be similar, and in the energy sector and water sector you say that they would tend to be more suitable. There's this question, what we can learn from the evidence on conditional cash transfers. So there's been this debate on whether or not to condition cash transfers, and there's a large literature on that you haven't surveyed. But how would this relate to CCTs and the results in that area?
There's of course a vast literature on CCTs, but from what I know, it is, and that is of course then the people themselves are incentivized to use a healthcare center or to send their children to school, and they get money for that. Poor people, often poor mothers. That I think the evaluations of that are on the whole quite positive, that it has worked to get more children into school, to get children more healthy, small children. So the evaluations of CCTs in general are quite positive. So maybe more positive than for what I found for the payment by results instrument. But I decided to exclude it because it is a vast area out of itself. And I also decided to exclude the voucher scheme, voucher schemes are often used in health, that, for example, pregnant mothers get a voucher, and with that voucher they can have antenatal visits at the health center, and they can get an institutional delivery, so they just submit a voucher. But this is not really an incentive, because, I mean, it's not a payment by results, because it's given ex ante to possible clients of health centers, and it's not an incentive to the health centers themselves. So I don't know really what we can learn from CCTs. That's a difficult question, but I think the evaluations are more positive than for payment by results on average.
I would agree completely with you, Geske, that they are absolutely more positive. And And if you look at the meta level a bit, you can also, I tend to describe it as if we had the budget support paradigm in 2005 peaking, we now have the social cash transfer paradigm, which is to me budget support to the poor, and they decide who to incentivize with their money. So in a way, it's stimulating also local markets in a completely different way. And I think we had the assumption back in 2005 that we could not reach the poor with cash transfers like that. It had to go through a government, or we have to work with the government and they would have agree.
Yeah.
What the last 15 years has proven is that together with governments and with other actors, it can happen. And that has really changed the dynamism in a way, which is also an interesting study to be done, I think. Of course, there's vast literature on it already, but from that perspective.
Yeah, it even doesn't need to be conditional, I think. And the cash transfers in itself, there's a lot of proof that they work well. If you can target the poorest regions, also in COVID times, there are countries that were very successful in this. And that helps, and indeed it stimulates local markets, it stimulates entrepreneurship, it stimulates that people can look for a job, they can pay the bus fare to look for a job, and it really works very well. And so it doesn't even need to be conditional. So in this sense, I would compare it with budget support, because with budget support, you also give it ex ante, and you have a policy dialogue, but yeah.
Exactly, and also if we, Jan has muted himself, so you and I can discuss. So also looking at field visits to people having been part of cash transfers, you can also see the social status within the community of poor people that have been given some money and some mandate.
Yeah.
That also changed the dynamism in the community and the voice of those people and their willingness to express what they want and what they can do and contribute. So that's where we are on that, Geske and I.
I muted myself for the public good. No, you were talking about the waves of popularity, and there's also a question of that related to the use of PBR, saying that over the period methods have changed and developed over the decades, often driven by donor-driven interest. Can Geske compare the various types and motivations over the decades? And may I guess that you also has something to...
Geske has the knowledge. Start with her.
But I didn't get the question exactly. What is the motivations for PBR, or?
Yeah. And now, so has there been a wave of PBR being more popular some years ago and now tapering off, or what? And what would be kind of the explanations for the change? Do you observe any change in the use of PBR over the years?
Maybe among bilateral donors. I think for the World Bank, they have introduced this program for results. And they did also, of course, output-based aid. They stimulated that already from around 2000 or even before that. So I think for the World Bank, it's a continuous effort. They want to do this, programs by result, payment by results. For the bilateral donors, perhaps the heydays have already a little bit passed. So that was more between 2010 and 2015, perhaps, and maybe it's already a little bit less. Also because, especially in Europe, it's preventing migration, it's promoting their own trade interests, private sector development. That are the themes that have come up. But I think for the World Bank, it's still an important area.
And complementing that, Geske's observation, of course, it's also, and it's part of the review when you discuss that it's also depending on the size of the contribution in relation to the results you want to achieve. And you're looking at World Bank contributions. They are 10 times, 15 times compared to a bilateral contribution. And of course, that provides a completely different arena for discussing indicators, right or wrong, but also for having the power in that and the power of the indicators then in relation to the total financing of that sector as such in the country.
Thank you very much. We are soon to conclude this seminar. So I would like, maybe starting with Ulf and then Geske, if you have any kind of concluding remarks or overall ideas that you want to convey to the audience.
First, I would like to then repeat my thanks to EBA and to Geske for doing this review, because I haven't seen a review like this before, where you have so many project evaluations and research documents that were reviewed, and you could see a pattern. You can see several patterns, of course. So that has been really useful for me and for my organization as well. Then, and then when you start to see patterns, you start to think about the future. Why are we where we are? Where would we like to go, etc. And so that I really take with me, bring from this seminar. Also, lots of thinking about what could be the next review and evaluation, which we can then discuss, Janne, later to see, what would be interesting areas to find out more about. So I would thank you very much for this learning opportunity.
Thank you, Ulf. We have a lot of reviews, and we have several coming up now, so I'm sure we're going to have a lively discussion on that. Geske.
Yeah, I also would like to thank EBA and also Jan and Ulf in particular for this nice exchange of ideas. I enjoyed writing the report. I look forward to further comments because it has just been published on the website, I understood. So I hope many people will read it and will provide me with further comments. That would be great. So thank you.
Thank you very much. And it's I think you summarized the discussion better than I would have. So I'll take with me, almost as usual in discussions like this, context, and how PBR is sometimes a solution, sometimes not a solutions, even though challenges might be similar. So it all depends on context and the importance of actually knowing when the modality is likely to function. I also take with me actually the what you wrote, Geske on the K instances where RBF has actually caused harm, because I think that is important to learn from. With this, I would like to thank you very much for your participation. Geske for writing the working paper and the presentation, Ulf for your comments and shared insights, and of course, not least the audience for all your questions. The report can be downloaded at eba.se. And when you do that, you will also learn about our other work, our previous studies, reports, evaluations, our seminars, as well as our podcast. And then you will also note that in Stockholm on May 29, we are arranging a launch of the World Bank's annual World Development Report, Migrants, Refugees and Societies. This is a seminar arranged jointly with Sida and the Migration Studies Delegation, DAOMI. You are most welcome to that one, but participation is by physical presence only, so you need to hurry to our webpage to register. So thank you very much for today, and hope to see you again soon.